Welcome to week 5 of our progression of rehabilitation, following an athlete from surgery all the way back to the field. Now, one of our goals in this week, our main goal, is to gain terminal knee extension so that we can help normalize gait. We want to develop a good strength base and start balance and proprioception exercises. Now, Maddie has 125 degrees of flexion, but she still lacks knee extension, and so we're going to continue to work on this through passive stretching. We're going to do some calf stretching. We're going to do some exercises to work into terminal knee extension, as well as some exercises that will stretch her. We won't forget working on flexion, and here we see her stretching in prone. To develop a strength base, we're going to do exercises such as step-ups, step-downs, which is more of an eccentric quad exercise, doing Bosu squats, which starts incorporating some balance. And we also want to start working on the hips, glutes, and hamstrings. The multi-hip machine is used for a variety of exercises. We do some lateral steps with resistance, some single leg back extensions as shown here, some seated hamstring curls that we had to improvise, and some bridging on the TheraBall to bring in, again, that dynamic component. You don't want to forget bringing in some core exercises such as some side planks. Now here's a video montage of some of the exercises. When we're doing the step-ups, we can see her simulating the swing phase of gait and of running, working on terminal knee extension, and bringing her balance over her standing leg. With the eccentric exercise, you can see we have something to assist with balance because her balance is still not very good. We want good body position, not too much trunk lean, and to focus on knee control on the way down and on the way up. And you can see it's a little bit of a struggle here for her to do, but she's able to do it. We start working on hip exercises. Now we're doing it in standing, so she's not as supported, working on abduction out to the side. You can see when she's standing on her involved side, it's harder for her to balance and she has to move more slowly, but it is a progression of using the multi-hip. With the seated hamstring curl, we can have her stretch into extension a little bit, as well as work into flexion within the ranges we're allowed at this time. I like using the back extension done properly. It helps work the glutes and hamstrings. We just want to make sure she keeps a good neutral spine and doesn't hyperextend. Here's another exercise we like, doing bridging on the TheraBall. Now you can see here she starts having some trunk control issues and is actually going to start drifting on the ball because she's not pushing evenly on each side and then she can't recover. Some side steps with TheraBand is a nice way to bring in hip abductors, some glutes and quads, and working on some knee control as well. All of these are very good exercises. We'll do some single leg press on the shuttle and use a BAPS board or some other dynamic surface to bring in that element of balance, and we'll see some more of this in the balance and proprioception section. Here you see Maddie doing some squats on the Bosu. Not only do we want her to work on her knee control, but also keep good alignment, keep her knees over her toes, feet about shoulder width apart, and just work on holding a nice static position and keeping her base of support level. She's actually doing quite a good job here considering this is her first time doing it. Normally I'll have them hold this exercise for a period of time while they do it. Now when we look at the BAPS, as they go down into the press here on the shuttle, you want to keep the knee, the toe, and the shoulder in a good alignment, which you see here, but you also want to keep the BAPS board as level as possible. On her uninvolved side, you can see she does this fairly well. You're going to see some excursion because there's a dynamic phase and it's on a movable surface. Now when we look at the surgical side as shown here, you can see that there's much more displacement of the BAPS board. You can see a lot more of the undersurface as she goes through the motion. We can get a dynamic surface with decreased proprioception. She can't control it, and this is shown as increased displacement as she goes through the movement. Now when we compare the surgical and the non-surgical side shown here, we can see that the left lower extremity had twice as much movement shown in yellow when compared to the right, which is shown in red. Increased movement is decreased proprioception. For week 5, we got our goal of increased flexion. We did not gain terminal knee extension as we wanted. We got a good strength base, and we started some balance exercises. I'm sure it's no surprise that our goals for week 6 are to gain full knee extension, improve strength, and improve balance. Have any questions about things seen in this week's progression? Please post them on the forum.